Hi friends, welcome to the Delirium Hackathon. My name is Peter Nydahl. I'm from Germany and I will speak about the rehabilitations of patients in delirium. That's quite a challenge because patients in delirium have longer periods of mechanical ventilation on ICU, a longer stay in the ICU, more sedation, more restraints, more bed rest. They have a cognitive decline, of course, also by the sedation. They have a worse rehabilitation outcome and they are highly vulnerable, so they require rehabilitation, but sometimes they are also not compliant, agitated, aggressive, and all these things are barriers to rehabilitation. So it's quite a challenge. What we can do, it's a different approach to rehabilitation when patients are delirious. So you have to change to adapt your talking. Be respectful, wait for consent, be meaningful for the patient. Sir, do you allow me to help you, to assist you, to help you standing up or whatever? So acknowledge the title, the name of the patient, of course. The content always prefer short-term goals. Patients do not think about walking with a dog again when they are back home, but they think about this chair. Would you like to sit in this chair at your bedside for, let's say, 20 minutes, for example? So be specific. Or what can we do to help you feeling better? Foot massage or calming music or whatever. We know that patients in delirium have difficulties to understand the language. They use less words than in usual life. So prefer short sentences, prefer to speak a dialect for the patient, for example, and integrate repetitions. Sitting in a chair, fine, great idea. Sitting in a chair, very good. And cooperate with the patient, stimulate his responsibility. Please show me when it will be too much for you. Please give the start command or show us when you will finish the sitting in a chair, whatever. So patients have the command, not we clinicians. And what you can do is offer patient-centered activities. For example, integrate the family or sitting in a chair, walking, eating, coming here. Use lipstick, for example. When it's highly important for the ladies, sometimes for the man, use lipstick or just chat with them. Kate Tentam showed us that gardening is an amazing project, also for delirious patients, or integrate pets. Ask for the habits. Do patients stand up on the right side or on the left side of the bed? Show patients the activity in advance, but from their perspective. When I raise my right hand, oh, it's the mirroring, the different side. So maybe you have to turn around and show the right side so that the patient can perceive from his perspective. Start slow movements, not just raise the arm, but start with a little movement, make it a little bit bigger, and then start with a movement so that the patient can perceive the activity, the direction of the movement, and can join in and work in the rhythm of the patient. We know patients, especially after a sedation, live like in slow motion. So behavior yourself on the patient's bedside as if you would be in slow motion, and then patients can join in. So just a few points, but very important for patients in delirium because they have a worse rehabilitation and they require a specific rehabilitation approach. Speak respectful, slower, in short sentences, and offer patient-centered activities. And of course, enjoy the hackathon and the World Delirium Awareness Day. Thank you all.